Hi, and welcome to Plugged In. Could you lose 80% of something and not even know it? That could happen if you have kidney disease. So March is Kidney Health Month, and on today's show, it's packed with information to help you be kidney smart. The March Drive is also taking place this month all across Canada, and volunteers are canvassing your community to help raise awareness and much needed funds in support of kidney patients across the country. So please give generously when a canvasser comes to your door. And join Deb as she sits down with Dr. Monica Beaulieu to talk about women and kidney disease. But first, meet our 4 contestants on our game show, How Well Do You Know Your Kidney Mate? They're going to answer the tough questions. So join us right now for this special Kidney Health Month episode of Plugged In. Hello and welcome to How Well Do You Know Your Kidney Mate? I'm Barb, the host of the Plugged In game show that asks, so you share a pair of kidneys, but how well do you really know your kidney partner? And answering the tough questions on our game show today, we are so pleased to welcome 2 kidney transplant recipients and 2 living kidney donors. These 2 teams share vital organs with one another, but what else do they really know about each other? Well, let's find out. Let's get started and welcome our contestants on the show today. And our first 2 contestants are actually newlyweds. Brian, is that right?
Brian.
Yeah. Hi, Brian and Kate.
Nice to meet you.
It's great having you on the show.
Thanks for having us.
A bit of a love story. You fairly newlyweds. How long have you been married?
I've been married a year and a half now.
September 2016,
September
we got married.
2016.
And fast forward a year, and Brian was so fortunate to donate his left kidney to me on September 6th of 2017. So we weren't quite married a year when he sacrificed a piece of himself to get me to feel better again. So.
Oh, what a beautiful love story. So you're the recipient?
I am the
You're
recipient.
the kidney donor.
Absolutely.
Yes.
So we're going to find out, although she has her kidney, how much does she really know about you, right? About her. Those tough questions coming up. But first, let's meet your challengers. Woo! I know Bethany. Hi, Bethany and Ray. The donor and recipient. Father-daughter dynamic duo. You may have recalled seeing Bethany and Ray on our show previously, and for the, was it Courtney Kidney Walk?
Yes. Yeah.
Well, tell us a little bit about yourselves. Thanks for coming in today.
How are you? I'm doing well.
Okay.
Yes. We've traveled over here today. Very excited to be here. My dad told me of his kidney disease in 2011, and the moment he told me, I thought, oh, that's something I could do. And so we had the transplant in November of 2016, so we're a year and a half post-op, and I'm doing very well. I'm fine, and he's better than fine. What's happening with you?
Well, I'm still going well on your kidney.
Thanks.
Very much for giving me the good one. And still going well, playing pickleball, back playing pickleball again. Her kidney and I were out there playing pickleball yesterday. So
I hope you got some pictures. You want to show those on the show.
Oh, well, oh, yeah. That's
Is
right.
it good competition, Bethany?
Yeah, it's nice to be healthy, and the one thing I'm glad of, I'm glad that she's healthy. So that was my number one concern in the whole thing. So we're both healthy, we're both happy.
And
here
you're
we
here
are.
on Plugged In playing.
Oh, plugged in.
How well do you know your kidney mate?
Ooh, yeah. I'm sure she kept some secrets from me, but
Oh, we might find those out today, Bethany. Watch out.
we just might.
March is Kidney Health Month, and the Kidney Foundation of Canada, BC and Yukon branch, wants everybody to be kidney smart and specifically increase their kidney health awareness. While everybody should know their risk for kidney disease, this year special attention is being paid to women and kidney health, which is the global focus for World Kidney Day. March 8th is World Kidney Day, and we're sharing this day with International Women's Day, which makes it a perfect time to reflect on women and women's health. When it comes to kidney health, kidney disease impacts women differently than men, and specifically this is true when it's women of reproductive age. Today we are here with Dr. Beaulieu, and she is an expert on women and kidney health. And we're going to talk about what it means if you're a woman with kidney disease, some of the challenges that you may face.
Well, thank you all for being such great sports and playing with how well do you know your kidney mate. For our viewers at home, we're going to just run through the rules, okay? In round one, we're going to send off our transplant donors. And they're going to go backstage, you're going to wear those headsets and enjoy yourselves. And we're going to ask 4 questions of the kidney recipients. Then we're going to bring Bethany and Brian back to the show, and we'll have you guys answer the same questions. Now, each team is going to get 10 points for the correct answer, and they're going to press one of these buttons. Let's practice. Oh, yeah. That will mean a correct answer. And then for round 2, we're going to do the same thing again. We're going to send off the recipients. So Kate and Ray will go out backstage, and they'll put on those headsets so they won't be able to hear anything here. And we'll ask 4 questions. They'll come on back in and answer those questions as well. Now, we've got a grand prize on the show today. So whoever has the largest point total at the end is going to get a $250 donation from Plugged In to the program or service of their choice. So let's find out what you're playing for today. Kate and Brian, yes. What is your service or program of choice?
We had 2, and I couldn't decide between them because they're both very important to me, and Brian's such a support to them when I'm doing stuff. And so we are going to split, if we win, the $250 between the Kidney March, which is the 100-kilometer 3-day walk in Calgary.
100 kilometers?
Yeah, over 3 days, but yes, it is a lot of walking. Wow. But it's amazing. I've been fortunate. I have completed it 4 times, and I'm about to start training for my 5th time this year. So I'm very excited for that.
I'm no mathematician, but 4 times 100 kilometers.
400 kilometers. 400 kilometers. I've been fortunate to walk them all, but it's for everybody possible. I'll talk about that a little bit later. But and the other one is our CanCell CKD, and that's on the research side of kidney health, which is so important as we move forward with trying to find solutions and better life expectancies and slowing the progression of kidney disease. And so there's 18 different projects right now that are being funded by this initiative, and so I've been very involved in that, and I'm really excited that hopefully if we win I can help share some of that money towards that cause.
Well, okay, that's fantastic. So really one is a patient services, yeah, and one is a research.
Yeah.
Wow. Exactly. So when do you find time to work or do anything else?
There are moments that it gets a little busy, but it's being able to provide back to my community that's given me so much over the last 7 years since I was diagnosed, that I feel very fortunate that if I can give back and help others that may not even know that they have kidney disease and help do that, that would be great. So.
Wow. And then Brian, you're here with her every step of the way, supporting her.
Absolutely.
Good support.
And your challenger is here today. We've got Bethany and Ray. Okay, so with yourselves, what program have you decided to support today?
We would like to support the Kidney Suite, which is the post-transplant accommodation for the recipients. And it was a key piece for my dad and my mom to be able to stay in the beautiful Kidney Suite in a fabulous location.
Yes, we were in Steve's Manor out in Kitsilano. So for my therapy after kidney, I got to walk on the Kits Beach and along in that whole area there, and we were very close to like a grocery store. So as much as I like my groceries, it forced me to get out and do that post-op walking and things. And it was nice because if you're in a hotel, it's got that commercial feel, whereas we had the home feel of a suite. And people could come over and visit us, and as well, they had a pool table down in the lobby,
so
I could
comes out here.
go down there and play.
We're so glad that you were able to make use of it. That's
it was
wonderful.
Great.
And as they say in Vancouver, location, location, location. Right?
Oh yeah.
So, it's really
Kitsilano. Not bad.
I think we've got 4 great sports ready to be playing. So without further ado, let's get going. Come back, stay with us, because we're ready to play.
How well do you know your
Kidney Mate?
Dr. Beaulieu, are women at greater risk for kidney disease than men?
Well, in general, we say no. Both men and women have pretty similar risks. But when you think about the fact that about 1 in 10 Canadians might have some degree of kidney dysfunction, there is still a huge burden of CKD out there. There's a few diagnoses that are more common in women, things like urinary tract infections, things like certain autoimmune conditions like lupus or different arthritis, and those can all lead to kidney dysfunction in some women. So in those populations, they are at a bit higher risk.
Can you talk a little bit about how kidney disease impacts women differently than men?
So still the most common diagnosis for both men and women are things like high blood pressure, diabetes, being from certain ethnic backgrounds, a history of heart disease, and some of those present differently in men and women as well. Women with autoimmune conditions definitely have a much higher risk of having kidney disease. We actually don't know why a lot of this is yet. Women also can develop kidney disease quite young and in their childbearing ages and be thinking of pregnancy or been wondering about the risks in their children of the kidney disease that they have. So a lot of other things for women to consider when they're given a diagnosis of kidney disease.
And you've just touched on something that I think a lot of women who have chronic kidney disease are probably wondering, and that is, those in their reproductive years, am I going to be able to get pregnant?
So those women who already know that they have CKD when they're pregnant, most women can still have a healthy pregnancy and do very well. It all depends on where you are in your stage of kidney disease. If you have pretty minor kidney disease or at the early stage, then there isn't much increased risk, but it's still very important that you plan out, if at all possible, the pregnancy. As the kidney disease progresses, you actually are less likely to get pregnant. And then if you are pregnant, there are some complications that may happen to mom and may happen to the pregnancy. Once you're on dialysis, it becomes quite difficult to even get pregnant, but not impossible.
And that's because reduced fertility.
Fertility goes down. Yeah, a lot of the hormones that allow us to get pregnant are just, those cycles aren't there anymore.
But if you are on dialysis and you do become pregnant, are there a number of increased risks, I guess, to mom and baby just by being on dialysis?
So if you do either plan to get pregnant and you're a dialysis patient and you don't have a transplant pending, that we usually increase the amount of dialysis that we give the woman to maximize the chance of being able to get pregnant to start with. And then traditionally we told women that they would do quite poorly if they got pregnant on dialysis, but there's been some really good studies looking at giving patients more dialysis during the pregnancy, and some very positive outcomes for mom and for
Well, that's
baby.
interesting, because you wouldn't think you would actually get more dialysis while you're pregnant.
Well, hi everybody, and welcome back for round 1 of How Well Do You Know Your Kidney Mate? Ray, Kate, are you ready? We're going to be asking them some questions about how well they know their living donor and their living donor kidney. So, Kate, first question on. Okay, if your donor, so that was Brian, if his kidney was an animal, what animal would it be?
Well, that's a hard one. There's so many different ones, but I think we have a new puppy at in our lives, and his one ear is kind of shaped maybe a little bit like a kidney, the little floppy ears sort of thing. So they could be the shape of a kidney. So I will say our puppy Mosby would be the animal that would represent his kidney.
Mosby, and how old is Mosby?
He's only 5.5 months.
Oh.
So he's cute and fluffy and, likes to get in trouble once in a while.
So a really new addition.
Yes.
Okay, Ray, I'm going to ask you the same question. So if Bethany's kidney had been an animal, what animal would it represent?
Definitely a cat.
Oh, a cat. Okay, so we got the dog and the cat. And why the cat?
Dog and the cat. Yeah. Oh, she just loves cats.
Oh.
Yeah, there's a new kitten at their house, Norvin, and she just loves cats. She's always had cats. I think this is cat number 4, so I would have to say a cat.
Okay, so we're going to lock in those answers: dog and cat.
Dog and cat.
We'll see if you get, see if you get 10 points on that. Okay, so question number 2, and I don't know if I mentioned this, that the questions get incrementally harder as we go along.
That was not in the rules, no.
Okay, so how about Ray, can you name one thing that you can now eat that you couldn't before your kidney transplant? Maybe that you love to eat that you couldn't before kidney transplant.
Oh, there's.
Because there's food restrictions, right?
Where's the whole list of food restrictions?
So the tough part is asking you to
I would
name
say
one.
now that I can eat that I couldn't before would be bananas because of the potassium content. Yes, I would say bananas, although tomatoes comes close, but I will lock in with bananas and we'll see that.
Okay, so prior to your transplant, you said you weren't eating bananas. So how long was that period of time?
Oh, I pretty well had to start right away. That was in 2011, right up to the transplant. I stayed away from bananas and I reduced everything, as you probably did. Anything with potassium, anything with salt, anything that tasted good, So you go on a straight cardboard diet.
That's really actually important that you had to modify your dishes to be kidney friendly, basically,
Yeah.
right?
Yes.
And we actually have a program on the KFOC website, which is Kidney Community Kitchen.
Oh,
and we've got a
yeah.
lot of recipes there.
Oh.
So, Kate, how about you? You probably had to do some modifications as
same,
well?
same sort of thing. There was lots of restrictions, which, once you got into the rhythm of things, it was like nothing different. And then you get to post-transplant, and it's almost like a 180 in the sense of there's new things you can't have because of the anti-rejection drugs that you're on.
Oh.
And then some of the other things you don't need to be as restrictive of, the amount of sodium, potassium and dairy and even proteins. So I'm going to say my favorite thing. I'm going to play off of bananas. Not that I'm a huge banana person, but I love banana bread. And so I will admit I probably snuck in a few pieces of banana bread here and there, but since surgery, I'm sure I've had a number of more pieces of banana bread.
Yeah, perfect.
Well, leading into that, Kate, question number 3.
Okay.
So, how much did your kidney donor kidney weigh?
Ooh.
Okay, so that's how much did your living kidney donor?
Yes.
So how much did Brian's kidney weigh?
Well, as you know, generally kidney, as they kind of say, you kind of take the size of your fist, and that's
Right.
kind of about the size. But of course, Brian's a male, and so his kidney is bigger than mine would be. So they weighed it in the surgery room, I
did?
guess. Yeah, they told us afterwards, and they said it was a full pound. So it's a big kidney, and lots of people don't know that the kidney actually usually goes right here in the front kind of pelvic area. So the first couple of weeks especially, I had kind of a little bump where the kidney was kind of protruding out because it was quite a big kidney. So, but I'm very fortunate because this kidney is quite large and very healthy. It's working wonderfully, so I can't complain of having an extra pound added.
Okay. Now, Ray, I don't know if they weighed Bethany's kidney,
No.
so we might have a...
Oh, it's a very easy answer for me, though.
okay.
Since my surgery, I think I've gained 20 pounds. So her kidney weighed 20 pounds.
Okay.
And you can believe
Love it.
Good answer. Is
and
that
I
your
walk
final
like
answer?
this now. Yeah. No. I would not. I'm going to guess what she would say. She would probably say a pound. I'm gonna guess that's what she'd lock in at, but I'm sure it was closer to 20.
Well, we'll soon find out.
Oh, yeah.
If a woman has had a kidney transplant, what does this now mean for her ability to get pregnant and have a safe pregnancy?
Yeah, so we have a large group of women who are in childbearing years and have had a kidney transplant. And so we have information on thousands and thousands of these women that have gone on to have very successful pregnancies. What I can tell women is usually we would like them to wait about a year at least, maybe a little longer after the transplant, so that their immune suppressant medications can be stable, their kidney function can be stable. But after that, we change them to medicines that are very effective for their transplant, but safe in pregnancy, and there are some. And then they're given the green light.
And their fertility levels are...
Returns to pretty much normal.
If a woman becomes pregnant but she does not have kidney disease, can she get acute kidney failure from pregnancy?
So the most often situation is where we actually find chronic kidney disease in pregnancy and that the women didn't know they had, because what young woman would go and have a blood test or a urine test if they weren't pregnant, going for another reason. So we uncover unrecognized chronic kidney disease in pregnancy in a lot of women. In other women who have no baseline chronic kidney disease, there's risks of what we call acute kidney injury or kidney function going down during the pregnancy due to complications that have nothing to do with the kidney, due to bleeding, due to other complications, and that may lead you to have an acute drop in your kidney failure.
Right.
And we know now, we used to never hear about these women because their kidney function would return to normal. They would be discharged, they would never really see a kidney doctor. Now through research we're learning that those little dips, however slight in their kidney function, over their lifetime, those patients are more likely to get chronic kidney disease. One of the other things that happens sometimes to women without kidney disease and with is something called preeclampsia. They used to call toxemia, all these different words for it. Blood pressure, protein go up near the end of pregnancy. You need to deliver. And preeclampsia was never looked at as a risk factor for developing kidney disease in the future, and now we know it is a risk factor for developing chronic kidney disease years later, and connecting these women in with some sort of surveillance becomes very important to make sure we uncover the patients that do develop kidney disease and monitor and treat them appropriately.
Well, that's really good information because that's a term I think many women are familiar with is preeclampsia, and yet probably most of them never think that there's any connection to potential kidney disease down the road. So, is it something that they should at some point maybe get the kidney function test just to see that everything is okay? Would that be a recommendation?
Yeah, I think so. So checking for kidney dysfunctions is quite easy. It's a blood test and a urine test that we usually do for a lot of other things anyways. And if women did that once a year, once every couple of years even, we would be able to catch those women and use treatment earlier.
So next question, Ray, goes to you. And I know that Bethany's musically inclined there.
Yes.
I've seen her at the piano, so we've got to ask. What name of a song would best represent your kidney donor or your relationship with your kidney donor?
Now let's see. I will go with the song that she's written. I'll see how that is. And it's called Glorious Green. Now she wrote this quite a while ago. I think she wrote that when she was pregnant with Quinn, which would be almost 9 years ago. So we'll just see if she gets that one. That's a challenge for Bethany. Glorious Green.
Glorious Green. It's locked in. All right.
All right. Yeah, I had a few moments to think about that.
Yeah.
So I'm going to connect it actually to our wedding song. And so it was the big song of that summer, which was 2016. So it was the Ed Sheeran. I think it's called Thinking Out Loud. And that's what we danced to on our first dance sort of thing. So that will be my answer.
Okay, well, we've had two great contestants here answering the questions. Stay tuned for round two because we are bringing back Bethany and Brian, the trans-living donors for Kate and Ray. And we'll see how well they do in answering these questions and how many times these 10-point lights go on. Coming up right next, stay with us for How Well Do You Know Your
Kidney Made?
The main message that I'm taking away today is that this is actually quite a hopeful situation, I think, for women who have kidney disease, but to be aware and to work with their healthcare provider to figure out the best plan for them should they.
Absolutely. I think that women with kidney disease face a lot of challenges trying to deal with this new diagnosis.
Yes.
And sometimes providers actually forget about the reproductive aspects as well and the issues unique to women. And so if I could offer some advice, it would be ask questions, plan ahead. If the first opinion you get is something that doesn't quite sit well, ask again, ask why. And most women, especially for pregnancy, in earlier stages of kidney disease or after a transplant, can at least have that discussion with a provider before they're attempting pregnancy about what issues unique to them might come up and what their risks are. And usually it's a bit more reassuring than the patient initially thought.
And you were saying earlier that you you do, this is your area of specialty, and you do a lot of counseling with women, not just here in the Lower Mainland, but all across the province, if they're considering maybe becoming pregnant or thinking about the family planning down the road.
Absolutely. I see a lot of women here in the Lower Mainland, but also see a lot of women either if they have to come down for another appointment or via telehealth or telemedicine. So I encourage anyone with kidney disease that wants to hear a bit more about their special circumstances, and if they're considering pregnancy, we'd be happy to facilitate a consultation and a discussion either with their care provider or with them personally. All depends on what they would like, yeah.
Well, I think that's very positive news that you've just shared, and I want to thank you so much for taking the time to join us here on Plugged In today, especially during Kidney Health Month, where we've got a special focus on women and kidney disease. So thank you.
Thank you.
Oh, that's all the time we have for today's show. So we're going to have to keep you in suspense just a little longer till our next episode of Plugged In for you to find out how well our two living kidney donor contestants, Brian and Bethany, match their answers from their kidney mates, the transplant recipients, Kate and Ray. Well, you want to find that out, so make sure you come back and check out part 2 of How Well Do You Know Your Kidney Mate right here next episode of Plugged In.
Through it.
Yeah.
Very
March
good.
is Kidney Health Month, and 1 in 10 Canadians have kidney disease, and I was one of them.
And many don't even know it because the symptoms are silent in the early stages and can destroy up to 80% of the kidney function before you experience any symptoms.
That is why it's important to know the risk factors for kidney disease, which includes diabetes, high blood pressure, heart disease, a family history of kidney disease, as well as being an individual from certain ethnic backgrounds.
It's important to know these risk factors because you might be able to prevent or delay dialysis or a kidney transplant. And if you are at risk for kidney disease, then get screened. Ask your family doctor for the simple EGFR test.
Remember, March is Kidney Health Month, so be
Kidney smart!
Nice.